A study done by the U.S. Centers for Disease Control and Prevention showed 2021 drug overdose deaths to be still skyrocketing. This occurring primarily by the explosion of fentanyl coming in from our southern border. The CDC said there were nearly 108,000 overdose deaths in the U.S., more than any other year. About two-thirds of these deaths involved synthetic opioids, such as fentanyl, a stronger and faster-acting drug than natural opioids. Fentanyl, even in small quantities, is lethal for most people. Many American opioid addicts become hooked on painkillers that were legally prescribed to them. But when their physicians become unwilling to continue prescribing them, many individuals turn to heroin, which is cheaper and more readily available. Fentanyl is 50 times stronger than heroin, making it even more addictive and lethal. And with the recent rise in illicitly made fentanyl, the drug is becoming increasingly cheap and available. Many heroin addicts shoot up with doses cut with fentanyl without even knowing that they're doing so. Some addicts turn to fentanyl as their tolerance to heroin increases. So how is fentanyl and other illegal opioids making their way into the U.S., now causing overdose deaths like we've never seen before? During an interview on ABC, Drug Enforcement Administration Administrator Ann Melgrim stated that a number of Far Eastern countries provide chemicals to Mexico, to the criminal drug networks that are then mass-producing fake prescription pills that are sold as legitimate drugs, but are actually laced with fentanyl. She also said the fake prescription pills are being sold like they were real Xanax, Oxy, and Percocent, but they only contain fentanyl. The people more and more purchasing these pills are not only younger people, but older Americans. Overdose deaths are the leading cause of death for men between the age of 18 and 45. There were more overdose deaths than car accidents and gun violence. Many of these opiate overdoses are due to people knowingly taking fentanyl, but an increasing number of other drugs, such as heroin and cocaine, are being laced with fentanyl and sold to people who don't realize what they're getting. With the drugs pouring through our southern border, Mexican drug lords and drug cartels have become billionaires. Don't mind the risks. And unfortunately, because of the high demand in the U.S. for fentanyl and other illegal opioids, the drugs keep pouring through with little to no resistance. As to who are the most vulnerable populations in the U.S. for an opioid use disorder, generally it's people with chronic or severe pain. Individuals who are prescribed opioids for pain have a 21% to 29% chance of abusing them. Unfortunately, fentanyl and other synthetic opioids continue to be overprescribed by doctors, in part due to the marketing practices of pharmaceutical companies. In many cases, a weaker drug would provide sufficient pain relief with far fewer risks. Poverty contributes to drug use, as does having poor parenting as a child, child abuse or early childhood post-traumatic stress disorder, wide access to drugs, aggressive behavior in childhood, and having a weak social support network. The solutions to ending the fentanyl epidemic in the U.S. requires a multi-pronged approach. Border security is extremely important. Foreign nations involved in exporting opioid chemicals should face severe sanctions and penalties. Drug rehab treatment programs and mental health programs should be more available. Drug prevention education in schools should be more utilized. And fentanyl testing strips should be more available to the general public. Testing strips would easily identify trace elements of fentanyl before anyone takes a suspicious drug. This crisis needs to be ended. We're losing thousands of people to the fentanyl and opioids. Looking the other way will not solve the overdose tragedy here in America. This is H.A. Graves.